Good morning, everyone. Thank you so much for joining our very first webinar for our open enrollment this year. You've joined the Retiree Medicare Health Plans Overview, and we have representatives from both Kaiser Permanente and Blue Shield of California who will be sharing information about their Medicare plans. Now, your microphones will be muted during the entire webinar, but we really encourage everyone to ask questions through the Q&A channel. There should be a menu bar either on top or on the bottom, depending on whether you're joining via your computer or cell phone. Click on that Q&A and you can ask us questions by creating a post. There'll be more instructions in the video that I'm about to play. Our presentation is pre-recorded to allow our representatives to answer your questions and just focus on answering your questions. And at the end, we will have a live Q&A session and we will read everyone's questions and the plan representatives will answer them out loud. So with that, let's begin.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF MyHub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF MyHub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Good afternoon, and thank you for joining today. In this presentation, we will be going over, at a high level, the Blue Shield Medicare PPO plan available to San Francisco Health Service System members, effective January 1, 2026. Blue Shield Medicare offers comprehensive medical and Part D prescription drug coverage with the freedom and flexibility to access care nationwide from both in-network and out-of-network providers. This plan is a good fit if you prefer to self-refer to specialists and see both in-network and out-of-network providers. Plan highlights to take note of include no or low copayment for most Medicare-covered services, access to virtual healthcare with Teladoc doctors, and coverage for medical care across the United States, including urgent and emergency care anywhere in the world. Blue Shield Medicare gives you flexibility and choice. You can choose to receive care from Blue Shield Medicare in-network providers. This option allows you to pay your coverage copay, and the provider will bill us directly for covered services. Or you can choose to receive care from out-of-network providers that participate in Medicare and are willing to treat you. Here are some helpful tips before seeking care from out-of-network providers. Check with your provider before receiving services to confirm that they participate in Medicare. If you receive care from a provider who does not participate in Medicare, you will be responsible for the full cost of the services received. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, confirm the services you are getting are covered and medically necessary. It is best to ask an out-of-network provider to bill the plan first. But if you have already paid for the covered services, we will reimburse you for our share of the cost of covered services. Or if an out-of-network provider sends you a bill that you think we should pay, you can send it to us for payment. As you can see on this chart, your Blue Shield Medicare plan gives you the flexibility and choice to not only see in-network doctors and healthcare providers, but also out-of-network doctors and providers at the same cost share as long as they participate in Medicare and bill Blue Shield of California. Blue Shield Medicare gives you access to pharmacies that offer preferred cost sharing across the United States. Major pharmacy locations include Albertsons, Costco, CVS Pharmacy at Target, Safeway, Vons, and Walmart, where you can receive a 3-month supply for 2 months' worth of copay for most drugs. Please note, members don't need to be a Costco member in order to obtain covered prescription benefits there. You may also have your maintenance medication delivered to your home or office at no charge for shipping. Signing up for home delivery pharmacy saves you a copay. Receive a 100-day supply for the cost of a 2-month supply of covered maintenance medication. To find a network pharmacy near you, or for more information on formularies and home delivery prescriptions, visit our website at blueshieldca.com/SFHSS. Blue Shield Medicare provides coverage for routine acupuncture and chiropractic care at a $15 copay per visit for up to 24 visits per benefit category per calendar year. These are non-Medicare covered services. No need to see your primary care physician for access. You can self-refer to any chiropractor or acupuncturist in the American Specialty Health Plans of California network. To find a chiropractic or acupuncture provider, go to blueshieldca.com/find-a-doctor. For out-of-state acupuncture or chiropractic services, call Blue Shield Medicare's dedicated customer service team for assistance at 1-800-370-8852. Your Blue Shield PPO Medicare plan membership comes with additional benefits: vision coverage, transportation for non-emergency medical appointments, personal emergency response systems that keep you connected to your caregiver network, complimentary gym membership with the Silver Sneaker Fitness program, and at-home meal delivery service to help with your recovery after being discharged from inpatient care. Accessing these services is easy. Just call our dedicated customer service line at 800-370-8852. We're open 7 days a week from 8 a.m. to 8 p.m. Pacific Time. Getting answers to your urgent questions has never been easier. The Blue Shield Medicare SFHSS website gives you 24/7 access to health plan information. With only a few clicks, you can get an overview of your Blue Shield Medicare plan, find in-network doctors, download plan documents, and get details on some of the benefits like emergency and urgent care around the world, preventive care coverage, and 24/7 virtual care with Teladoc, and so much more. Members will have direct access to Blue Shield Medicare's dedicated customer service team to answer any questions members may have regarding their plan. Additionally, the highly skilled Care Navigator team is here to help with scheduling appointments and care coordination. Members receive dedicated support from the pharmacy technicians on any pharmacy or formulary questions. Thank you for watching the Blue Shield Medicare PPO Plan overview video.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 2-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. We can help you get to your healthy place no matter where it is. We combine care and coverage, which makes us different than your healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you. Through our electronic health record, they can see your health history such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, and pick up prescriptions, all without leaving the building, making your care feel easier, faster, and centered around you. Kaiser Permanente doctors have one priority: your health. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Your care team also uses your electronic health record to help you schedule checkups and tests. When you need care, you can talk to a clinician in person, over the phone, or by video. Same day, next day, and weekend appointments are available at most locations. You can also get advice 24/7 over the phone and online through an e-visit at no cost, saving you time and money. Telehealth services are not an add-on at Kaiser Permanente. They're covered at no additional cost by most plans and have been a part of how we deliver personalized care. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health record, so you never have to repeat your story. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions in person, over the phone, online, or on the Kaiser Permanente app. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Since keeping you safe and healthy is our priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics located in select CVS and Target stores, the Little Clinic locations, or Concentra Urgent Care Centers when traveling outside a Kaiser Permanente area. If you seek urgent care at a Minute Clinic, the Little Clinic, or Concentra Urgent Care Center in a state where Kaiser Permanente is located but are outside one of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, there's the Away from Home travel line available 24 hours a day, 7 days a week. kp.org/travel is a special section of our website that's focused on getting care while traveling, and you'll have the ability to refill eligible prescriptions early in preparation for travel. Your mind and body are connected. What you think, feel, and do affects your total health, and we are committed to caring for the whole you. We provide clinical and support services for a wide range of conditions, from stress and anxiety to drug dependence and autism spectrum disorders. Our mental health includes psychiatrists, psychologists, as well as family therapists, licensed clinical social workers, and addiction medicine physicians. And as a Kaiser Permanente member, you don't need a referral for mental health care. We also provide members with tools and resources to process self-care like guided meditation and wellness apps. Now let's see how we are using technology to give you more convenient ways to get care. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Now let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. Chiropractic and acupuncture care services are also included. These services are covered when provided by an American Specialty Health Plan participating provider. You can obtain chiropractic and acupuncture services without a referral from a plan physician. Call or visit the website on the screen to find a participating provider near you. Get fresh, nutritious meals delivered to your home at no charge. As a Kaiser Permanente Medicare Health Plan member, you can get fresh, healthy meals delivered to your home immediately following an inpatient stay at a planned hospital or skilled nursing facility. OnePass can help you find a fitness routine that's right for you, whether you work out at home or at the gym, and it's available at no extra cost. Need a ride to the doctor? Your plan covers that. You can get a ride to and from your doctor visits at no charge up to 24 one-way trips or 50 miles per trip per calendar year. You can sign up through your benefits administrator over the phone with a Kaiser Permanente enrollment specialist or by entering some basic personal information at kp.org/choosekp. After you sign up, we'll reach out to help make your enrollment as easy as possible. We can help you transition your care, easily move prescriptions so your treatment is uninterrupted, and find a care location that's close to your home, work, or school. You can choose your new doctor, browse doctors by location, and see details about their education, specialties, languages spoken, and more online. Choose your doctor based on what's important to you and change it anytime. Within 10 days of your start date, you'll get a personalized welcome book in the mail, a welcome call from us, and your ID cards. And once you make your first appointment, you'll get a pre-visit call. Thank you for your time and attention. Today we reviewed our integrated quality care, digital care options, and membership perks. Please visit kp.org to learn more. Now you have the information you need to select with confidence Kaiser Permanente.
Great. I want to invite our vendors to turn on their cameras as we'll be starting the Q&A session now. The first question was from MW, who wanted to know where they can find the retiree benefits guide. John, can you help answer that question?
I believe I posted that in the website. I mean, on the, I believe I posted.
Yes. If you can go to sfhss.org/OE 2026, you can scroll down and find retirees section. And from there, all of the information, including the benefits guide and rate sheets, will be there. So thank you so much for asking. And Bill asked if the city contributes to Medicare premiums that we receive from the U.S. Health and Human Services based on income-related monthly adjustment amounts, or also known as IRMA. And if so, how do they get those reimbursed? Sean, can you also help with that? John had written the answer was that actually HSS does not contribute to IRMA. So I see John's, I think we're having some technical difficulties. And next question is from Francis, who's interested in non-Medicare dependent with Blue Shield Access Plus or PPO programs and the cost. Laura, can you please answer? That's one of our split family members who probably have Medicare, but their dependent is non-Medicare.
Unfortunately, I don't work that section. I only work the Medicare.
Okay, well, I do know, and Olga, let me know if you could find that information, but at our website, sfhss.org/OE 2026. Olga, would you mind pulling up the link for them to see the rates for mixed Medicare, where they're a Medicare member with non-Medicare dependents?
Yes,
And the
absolutely.
benefits are also available
Yes,
on our guide
absolutely.
online. So
I'll
that
go
is a
ahead and
great question, and we do have several members in that situation. So thank you for asking that, Francis.
So I'll go ahead and drop in the link to the different rates for that. But the difference between the PPO and the Access Plus plans is going to be that the PPO is obviously you have a wider network. You're not required to have a primary care physician assigned. The Access Plus plan is an HMO plan, so you're going to have a narrower network. I'm also going to include the benefits guide, and I'll let you know what page this is going to be on, to be able to kind of do a comparison of the plan, what's included in the plan from co-payments and the different elements that are covered in there. Just one moment here. I'm just pulling up the link here. I'll include that to the question, to the additional question that was asked, and I'll include the page numbers for you as well.
Great. Thank you so much, Olga. And for everybody on this webinar, just to let you know, if you go into the Q&A section, you can see these responses and answers in the comments to everybody's posts and questions. So if you just click on the comment box, you'll be able to see it. And then the next question comes from Ann Bingham. What is the difference between Medicare Advantage plan and a Medicare supplement? And I saw Laura responded, and I know, Julie, you probably have an explanation as well. But Laura, could you explain the difference?
Certainly. Medicare supplement plan, you must have Medicare Part A and B, and it supplements strictly what Medicare approves. It must go through Medicare. You present both your Medicare ID card and your supplemental card. It will go through Medicare first and then through your supplemental. Whereas an Advantage plan, it is strictly one card. It does not go through Medicare. It comes directly to the Advantage and it is processed there. You get the same benefits as original Medicare and then some additional benefits. So that's the big difference between Medicare Advantage and a supplemental. You must have it go through two insurances on the supplemental, and under an Advantage, it's just a one-stop shop.
Great. And Julie, did you have anything to add to that?
Nope, I think Laura did a great job.
Thank you so much. And thank you, Anne, for asking that question. Francis asked the next question, which is what was the ability to pay co-pays on the Blue Shield site? Laura, can you answer
Certainly,
that?
the copays are directly given to the doctors. So some doctors do require you to pay that upfront to them, or they'll send you a bill, but that payment is directly to that provider or provider's office. It is not facilitated through our website.
Great. And the next question, Francis wanted to know, how do you sign up for Silver Sneakers?
Certainly, there's a few ways. You can go out to the Silver Sneakers website. You can go to the SFHSS's website through Blue Shield of California, or you can contact our customer service and they can facilitate that registering. And again, I did put the phone number out there of 1-800-370-8852 to contact customer service, customer care to get that registered for you. So there's multiple different ways, whatever you're the most comfortable with.
Great, thank you. And Anne asked, will Silver Sneakers include membership to YMCA?
Currently, it does not. We are constantly working with Silver Sneakers to expand the network. So again, it is something that could change. We don't have line of sight that it is changing anytime soon, but always do contact our customer care for the most up-to-date providers in your area to utilize the Silver Sneaker.
Right, and Margaret wants to know, is Walgreens another retail for prescriptions? Laura?
It is one that you can utilize under us. It would go under the standard pricing for the copays, but you could definitely use it. It's one that you can use with your insurance. Yes.
And can you elaborate on that? Because I believe there's preferred pharmacies and there's also other pharmacies they can use, but there is a difference if they go to a preferred pharmacy. Is that correct?
For the 30-day copay, there is not, but if you go ahead and get the up to 100-day, there is a difference of pricing. At a standard, you will pay the full three copays, where a preferred, you only pay the two copays. So if you're only picking up a monthly, there's no difference, but if you are getting the up to 100-day supply, you will see the difference in the copays there.
Great, thank you. And Judy wants to know if we will be providing a PDF of the presentation from our vendors. We'll be providing a recording of this webinar where you found it on our calendar, OE, on our website /OE 2026. We have our calendar. So for this webinar on this date, we're going to post the video. And then Paul asked, I'm currently covered by Blue Shield Medicare PPO. Do I understand correctly that if I don't do anything during open enrollment, I'll automatically be re-enrolled in the Blue Shield Medicare plan? Yes, that is correct. You'll still stay on the Blue Shield Medicare PPO plan for next year if you do nothing. And then R asked, does Kaiser waive copay for delivered prescriptions? Julie, can you help?
Sure. We do not waive co-payments for delivered prescriptions. Prescriptions that are available via mail order, you can get a 100-day supply for the cost of 2 co-payments. But the delivery, the shipping costs are free. But you are still required to pay 2 co-payments, but you get a 100-day supply.
Thank you. And Mike Bolte wants to know, is Kaiser coming to Reno, Nevada? Will SFHSS honor this? Renown in Reno says Kaiser is taking over. Also, my Medicare starts December 1st. We chose Blue Shield. Does this start December 1 or January 1? Also, my wife has sent all paperwork to SFHSS and wonder if it was received. Mike, we don't have the ability to look up your specific account information. If you call Olga, is this a situation where they should call member services?
Yes, exactly. So I could answer part of the question in terms of when your benefits will start, when you will be enrolled into the Medicare plan. If you are turning 65 in the month of December, you will be transitioned to the Medicare plan in December rather than in January, when the new plan starts. Please do give us a call. We are at 628 sorry, don't call the number very often, 628-652-4700 for your specific situation to make sure that your documents were properly received. But if you are transitioning from a non-Medicare plan to a Medicare plan, it will be at the earliest, excuse me, not with the transition with into the new plan year. And at this time, I could also answer the first part of the question. At this time, we're not expanding Kaiser into the Nevada area.
Thank you. And Anne asked the next question, which is, do you have any information about Blue Shield scheduling a yearly medical evaluation in the home? I was kind of suspicious of the company that called me. Laura?
Certainly. And yes, we do get this a lot where people are suspicious about those companies that do call. We do have, I do believe, 2 different companies that make these call outs for us. They just come in, they do a full risk assessment. They can do it over the phone or they can actually come in person. The choice is yours. If this is something you're interested in, give our customer care a call at 1-800-370-8852, and it is in the comment too, and they can get that set up for you. And again, this is something that we do just to assist our members when they join Blue Cross, or I'm so sorry, Blue Shield of California.
Thank you, Laura. And R wants to know, what areas are Kaiser planning to expand to and when?
So we are not privy to any sort of information on expansion plans. I do know that we recently added the Del Monte Medical Office in Reno as part of Kaiser Permanente, expanding into Nevada in 2026. But that's as far as the information that we've received.
Thank you.
Mhm.
And the next question is also for Kaiser. Anne wants to know, can Kaiser retiree Medicare members who are ordering medicine, can they order from other pharmacies such as Costco, CVS, or Walgreens?
No, with Kaiser Permanente, you do need to order your prescriptions through Kaiser Permanente. That's why, especially if it's available via mail order, you can just go online or give the pharmacy a call and they would be able to mail it out. If you need to go in person, you would have to go to a Kaiser pharmacy.
Thank you. And Irene asks, unfortunately, I'll need both our plan representatives to answer because we're not sure which plan. But Irene would like to get a list of the complimentary gyms included in the gym membership benefits and what is the process to receive transportation for non-emergent services. And both our plans have this have these benefits. So we'll start with Kaiser.
So for the gyms, to get a list of gyms, you can actually go to your1pass.com. I don't know if there's a way for me to put that URL in the chat for everybody if I start a discussion.
I think if you go into Irene's question and then
Okay.
you go to comment, you might be able to do, oh, you know what? Paulo already put that in there.
Oh, great. Okay, so go to your1pass.com and then you can type in your zip code and you'll be able to see a list of the gyms. For the transportation, if you go to the HSS website, we do have all the flyers for the transportation benefit there. I don't know if we can pop a flyer. Maybe Paulo can pop the flyer into the chat.
I already did. It's in
Oh,
there.
thank you. Thank you. So there's the website you can go to, and then also you can download the app, which is what we would recommend you do. And then you need to request your ride at least 2 or 3 days in advance if you're able to.
Yeah, that's a good point. So if it's not like Uber, you don't order it, right when you need it. Laura, can you answer for Blue Shield?
Certainly. I'll just back up to the rides. Also with Blue Shield, it's something you do also have to do in advance. Customer care can definitely set that up for you. They can go ahead and set those rides up. It's directly through Medicare to do that. And then as far as the complimentary gyms, on our website, also the blueshieldca.com/sfhss has the listing of the silver sneakers gyms. And again, our customer care can go ahead and reach out to you and get that information mailed to you if you'd like to.
Could you put the phone number and also links in the answer
Certainly.
for Irene as
Yep.
well?
Yep, will
Appreciate
do.
that. Thank you so much.
Hey,
And
Jessica.
this
Jessica,
next,
this is Holly Lopez. I'm supporting Jessica in our webinar today, and this is just a reminder that even though we're here live, we want to make sure that we're not putting any personal health information. So phone numbers or DSW numbers, we want to protect that information and be able to answer anything at the general broad level right now. So thank you.
thank you for that reminder, Holly. Thank you so much.
And
And
Jessica, while the presenters are catching up on the questions, I see a trend on a couple of questions being asked around applying for Medicare. I can do a general information on that, and then folks can catch up on the comments there. I think we have plenty of time for that. So for those of you who are going to be turning 65 in the very near future, happy early birthdays. So you will be required to apply for Medicare in order to continue with SFHSS health coverage. So about 90 days and 30 days before your birthday, you should be receiving a notification letter from us reminding you to apply for Medicare. You'll also be receiving letters from the Social Security Administration reminding you to apply for Medicare. Once you apply through the Social Security Administration for Medicare coverage for Medicare Part A and Medicare Part B, please provide to SFHSS your Social Security award letter showing that you've been enrolled or your Social Security card showing that you've been enrolled into Medicare Part A and Medicare Part B. We will then be enrolling you into the one of the Medicare plans, whether it's with Kaiser or with Blue Shield, depending on which plan you were enrolled with before. If you, as a non-Medicare retiree, are enrolled in HealthNet, because we don't have a similar Medicare plan with HealthNet, you'll be transitioned over to the Blue Shield plan unless you make a choice to enroll in Kaiser. That's going to be up to you, but you just can submit an application to us letting us know that you'd like one plan over the other if that's the choice you'd like to make. So for those of you who are going to be turning 65 in the near future, please do make sure that you're enrolling with the Social Security Administration early on. You could start 3 months before your 65th birthday and then getting that information over to SFHSS so that we can continue you on the SFHSS sponsored plans. The same thing goes for any retirees who have dependents enrolled in an SFHSS covered plan. You want to make sure that they are also enrolling in Medicare. So either your spouse or your registered domestic partner, make sure that they are also enrolling in Medicare once they are eligible and providing that information over to us so that they can continue their coverage.
Thank you so much for that. And congratulations to everyone who's about to have a birthday. Happy soon to be birthday. So the next question, and I do apologize if I pronounce your name incorrectly, Marite Hunier. Will Medicare cover care away from home? Laura, do you want to answer that first?
Care away from home and United States and its territories, you would have the exact same benefits as if you were in California. That is not any concerns. We work with the local Blue Cross Blue Shields or Blue Shields or Blue Crosses for their network of providers to guarantee the same benefits. It's hassle free. If it is out of the country, though, we do have to follow Medicare guidelines and we only cover in emergency situations, but we would definitely cover you if you were visiting outside of the country and had an emergency. And we have a team that works with you to assist you with getting those bills sent to us so we can get those processed.
Great, thank you. And Julie for Kaiser?
So if you need care when you are away from your Kaiser service area, if you, we cover you for emergency and urgent care. So you can just go to the nearest facility if you're not able to come back to your home service area for treatment. And then as soon as you're able to, or somebody can on your behalf, you can give us a call at 951-269-3900, and I'll put that in the chat. Or you can go online to kp.org/travel. We also recommend, because sometimes it can be difficult to understand what happens, especially with Kaiser. When you're outside of Kaiser, you can always give us a call or go to that kp.org/travel site in advance of any travel plans and just get a little bit more information on what exactly you need to do, where other Kaiser regions are. Maybe you're going to need to get some prescriptions if you're going to be away for a while and you need, an additional month of prescriptions. You can also make an appointment with our travel nurse. And if you are, let's say you're going abroad and you want to know if you need any vaccinations or immunizations, et cetera.
Now, the next question is sort of expanding on that from Dono. What if I live abroad for part of the year? Which plan would be best?
So for Kaiser, if you live abroad for part of the year, Kaiser is not outside of the United States. So you would not be able to be in the Kaiser Permanente plan.
And for Blue Shield, because of the limitations with Medicare, we can only cover you for emergency situations. So your regular doctor's visits and that would not be something that would be covered with us.
Thank you. And we have another question regarding the one pass membership guarantee forever as long as you are a Kaiser member. Julie,
Yeah, I did respond in the chat. Unfortunately, we're not able to say that we can guarantee one pass. One pass, we're in contract with one pass, so they are a vendor. We evaluate benefits and we evaluate vendors. You know, we sign a contract with a vendor for a certain number of years, and then we reevaluate that relationship. So I can't really speak to us being able to provide something like that forever.
thank you. And Marsha Maloof wanted to know the Blue Shield website for hopefully it's SFHSS members. And Laura provided that in the chat in the comment. I believe it is blueshieldca.com. Laura, correct me, / SFHSS.
Yep, got it.
Great. And then Angela Blackwell wanted to know, I'd like more details about Blue Shield Medicare coverage out of state and out of the country. How does that work? I think we just mentioned that Blue Shield is a national plan. So you can choose to live anywhere in the US. And Laura, didn't we expand coverage to US territories?
Yes.
I know for this year we've got some expanded US territories like
Yes,
what is
we
it, like
did.
Guam?
Yes, and Puerto Rico, and I can't remember all of them right off the top of my head, but yes, we did.
Like Mariana Islands. So you could still have your Medicare plan there. As far as out of the country, I believe both our vendors have explained that for emergency services, you are covered. But Medicare does not cover your basic medical care outside of the country that you'll have to get completed at home. Now, if a surgical doctor does not accept Medicare, but the hospital where the procedure is performed is in network, will the patient be charged for the hospital service? Oh, Laura?
Yes, certainly. Just because the provider does not accept Medicare, there's two different kinds of not accepting Medicare. There's the does not accept a Medicare assignment where they charge the 15% above Medicare allowance. That is still something you can submit to Blue Shield of California, and we will definitely process that. The hospital or for the other option is if they opt out. That means that they do not have any contract whatsoever with Medicare. If the provider has opted out of Medicare, we cannot process that claim. However, each the doctor and the hospital each separately bill. So we still can process the hospital services, even though we won't get the doctor services to be processed. And again, it will just make sure that it's something the Medicare does cover and approve, and we will process it to the benefits of your policy.
Thank you, Laura. Gwen Leon Fitzsimmons, I'm so glad you found the Q&A section. I did see that your hand is raised. So going to the Q&A section and typing in your question is the best way for us to answer your questions. Your question here is, I'm concerned about Kaiser Healthcare Plan, about the gym, specifically YMCA gym in San Francisco. Is the Kaiser plan, the one pass, is that considered premium membership for YMCA?
So for one pass, Kaiser members can access standard and premium gyms. I think then she had another question. I think she said one pass could not answer, I'm guessing could not answer if the YMCA in San Francisco was part of one pass. So I need to look into that. I wonder if there's a way I could get Gwen's email address to get in touch with her once I do the research, or how do you want me to handle that?
So we don't want anyone to share personal information,
Okay.
but Gwen, we do, Kaiser actually offers, oh, does Kaiser offer office hours for our retirees?
We
We
do.
do.
We
Yes.
do. It's on the Kaiser microsite, and I'll look for that question and I'll post the link for them to book an appointment.
Okay, and that's with Gwen Leon Fitzsimmons.
Perfect.
Thank you.
Okay,
And
thanks.
the next question's from Anne. Do both people have to be on either the PPO or HMO for the multiple people, one being non-Medicare? Olga, can you answer that question?
Sure. So if you are a non-Medicare retiree, you're going to be enrolled in the same plan as or your dependent will be enrolled in the same plan as you are. So for example, if you choose to enroll in Kaiser, you and your dependent will be enrolled in Kaiser. If you choose to enroll in Blue Shield, for example, Access Plus, you and your dependent will be enrolled in Access Plus. If you are a Medicare retiree and your dependent is eligible for Medicare, if you are enrolling in Kaiser, you will be enrolled in the Kaiser Senior Advantage Plan along with your dependent, and the same thing will go for Blue Shield. If you and your dependent are Medicare eligible, you and your dependent will be enrolled in the Medicare Medicare MAPD PPO plan. If, however, either yourself or your dependent are not yet eligible for Medicare, there will be what we call a split family. So if, for example, we'll use you are Medicare eligible and your spouse is not. If you enroll in Kaiser, you'll be in the Kaiser Senior Advantage Plan, while your dependent, your spouse, who's not yet Medicare eligible, will be in the Kaiser HMO plan. Same scenario, you're Medicare and your dependent is not, and you're enrolling in Blue Shield. You will be enrolled in the Blue Shield MAPD PPO plan. Your dependent can be enrolled in either Access Plus, Trio, both HMO plans, or the Blue Shield PPO plan. It's not going to be the Medicare Advantage plan. It's going to be the regular Blue Shield PPO plan. So that's where the variances can happen is if you and your dependent are not both either both Medicare eligible or both not yet Medicare eligible.
Great, thank you. The next comment is from Lily, who's a previous Jim Peninsula Health District Fitness Center is not available under Silver Sneakers. So we know there was a gym difference, different access to gyms when we switched to Silver Sneakers, but actually United Healthcare was also going to switch all of our members to Silver Sneakers as well. So we do apologize. We know that the gym access has changed, and we hope that and I don't know if there are expansions with Silver Sneakers, but it's good to just check online to see what will be available in your area. But we do hear your concern, Lily. The next question is from R. We were told Kaiser Senior Advantage through SF does provide the additional benefit of Medline that provides certain dollar amount per year for health supplies such as vitamins, bandages. Please confirm. Julie?
So Kaiser Permanente does offer it's called an over-the-counter, like a rider, through Medline, but that is something that is not on the HSS KIPSA plan. So that is not included in your benefits.
Thank you. And then Janet Tom wanted to know if Blue Shield California PPO allows us to go to any medical practitioner. If that's the case, why are we only allowed to use Chiro acupuncture from ASH? Okay, so it is any as far as the medical providers, it is for those that accept Medicare. And can you explain the ASH benefit, Laura?
Certainly. So I'm going to take these two different questions and answer them both separately. With a PPO, yes, you're allowed to utilize any provider. For Medicare covered benefits for Acu and Cairo, you can utilize any provider. Once you want any benefits that Medicare typically doesn't cover, acupuncture for different things besides chronic back or chiropractor above the certain amount of visits. That's where ASH comes in. These are the benefits that are above and beyond Medicare. Therefore, we utilize the vendors contracts for those providers. So that's why you must use ASH for those supplemental benefits. But anything that's covered through Medicare, you still get to utilize our PPO network and still get to choose who you want to go to. I hope that clarifies.
Thank you, Laura. And Anne had a similar question to a previous member who wanted to know if we offer OTC benefits for Kaiser. And I believe Julie had mentioned that OTC products are not available under the HSS Kaiser plan. Mary wants to know, does Silver Sneakers automatically roll over with the current Blue Shield continuation for 2026? Laura?
Yes. So when you continue with us, we continue giving your information, your identification number and information to Silver Sneakers. There's no need to re-register. You will automatically be enrolled.
Thank you. And Robert wants to know, for the Blue Shield Medicare PPO plan, that's a Medicare Advantage plan, does he need to go through a PCP for referrals to specialists?
As far as Blue Shield is concerned, no, you do not need a referral to see a specialist. Some specialists require it, but as far as the insurance itself, if you choose to go to a specialist, we do not require a referral to cover those benefits.
Thank you. And Julie, I believe Olga answered your question about signing up for Medicare earlier. So I'm going to go to the next question from MW, which is a question for KP. I'm a non-Medicare for 2 months, 2026, but next March, there'll be a Medicare. And I believe Olga answered that as well. Marilyn Lee, may I request a hard copy of the benefits plan for 2026? And I believe Olga sent you the link to the information online. And Marsha Maloof, what is the Blue Shield website?
I can type it again up there. I'm just catching up still, but
Okay, great. Thank you so much.
And
And then
Jessica, for that
Diana,
question, just to make sure, can we clarify what the SFRA is? That's that website is
that
for
is
the
the second
SFRA.
time, yeah, I've seen SFRA in our, and yeah. Marcia, could you let us know what SFRA is? Because this is for SFHSS, San Francisco Health Service System members. And
That would help us be able to provide the link that you're looking for in case this question's come up twice. We just want to make sure we're getting the right link for you. Thanks,
thank
Jessica.
you.
Mhm.
Thank you. Now, Diane Kenny wants to know, when they turn 65 and, okay, Olga answered that question. 3 months in advance, about 90 days, you want to make sure you apply for Medicare in advance. And at that time, you can also then contact the health service system to let them know that you'll be transitioning from a non-Medicare plan to a Medicare plan and enroll at that time. Pablos wants to know, what options are there for health coverage, if any, if I want to retire abroad? Olga?
I'm sorry, Jessica, can I get back to that? Can you repeat that question again? I was catching up on the ones on top.
Oh, yes, sorry.
Sorry about
Pablos
that.
wants to know, what are the options for health coverage if they want to retire abroad? I believe that's our PPO out of area plan.
Well, that's correct. And as you've heard, the representatives indicate that we do have emergency coverage, and there are support systems to be able to get those coverages paid for, or bills submitted to Blue Shield for that. And depending on whether you're retiring in one of the expanded areas for this year, and I believe it's Puerto Rico, Guam, American Samoa, and the Mariana Islands are the ones that are included into the Blue Shield network.
Yeah. And Pablos, if you mean something like Europe or Asia, that's not in the US, so you would not qualify for a Medicare plan with SFHSS. We do have a commercial plan, the Blue Shield, the regular Blue Shield PPO plan. There are different coverages because once you're abroad, basically everything you're doing is considered out of network. And so you would be paying the out of network rate for those benefits. We encourage you to, I think this is a scenario where they should call member services, right, for more information. But Olga, so it's Pablo's who asked that question. Can you send him the link for our commercial PPO plan?
Yes, absolutely, will do.
And
Thank
Jessica,
you.
we're at the 5-minute mark. We're respecting everybody's time today, so we'll be ending promptly at 11. I know Jessica's going to work through as many questions as possible, but we may not get to them. Another staff member from HSS is going to drop in some links just to resources to answer any questions that we may not get to today.
Yeah, thank you so much, Holly. So Linda, why do we get 2 copay bills for radiology service, MRI, and radiology service? Second one is for the facility. Laura, that sounds like a Blue Shield.
You shouldn't get that. It should be one copay per day. If you see that happened, please give us a call at our customer service. Customer services phone number is going to be that 1-800-370-8852. I will put this in that comment. And they can go ahead and check to see what happened to get that to be one copay because the benefit should be one copay per day.
Great, thank you. And thank you for asking that, Linda. Marilyn wants to know if Blue Shield offers free home COVID test kits. Laura?
That one, unfortunately, I don't know. I was trying to hopefully get an answer, but my contacts didn't respond. So unfortunately, that will be a takeaway. I'll go ahead and definitely give our customer service center a call. But I will also try to find out an answer. So maybe if there's a Q&A response sent out to everybody, that answer will be there.
Great, thank you. And then I've got a few Medicare questions that we answered. So Anne wants to know, are there doctors in Marin who accept new patients if we are new to Blue Shield? They're having trouble finding one. And we definitely recommend you call the Blue Shield phone number and have one of the representatives. Laura, if you could pop that number into Anne Magida. Will do. Message, thank you. Flora asks, what is covered under Kaiser's travel medical emergency plan? What's the process to get help when we are abroad? I know Julie answered that earlier, but Paulo, could you maybe send Flora the link for traveling abroad and emergency service? How are they able to? I think it's getting reimbursed.
It is in there. It is in Flora's.
Oh,
I
okay,
think
perfect.
I put it in there. Yeah, kp.org/travel.
Thank you. Teresa wants to know, for Blue Shield, is there a direct number to discuss medication denial? Yes, there is. Teresa, Linda will be dropping in that phone number. It is the Blue Shield. So HSS members have a special concierge phone number just for HSS numbers, and Laura's going to share that. Linda, 2 copays question. Oh, yes. Laura just asked that. Steve, sorry, my question is regards to Blue Shield Vantage. It must be another question. So thank you, Olga, for the comprehensive answer. Thanks. Julie wants to thank you. Irene, I'm confused. I'm turning 65 next year. I was told by Medicare representatives I don't need to apply for Medicare. Medicare will auto enroll me by 11/1.
So we can't answer questions on how Social Security does their enrollment, but what you're going to want to ensure is that you are enrolled as of your 65th birthday and that you are providing that information to the health service system so that we can make sure that we continue your enrollment into the plan that you are into the Medicare version of that plan. So like I said, we can't answer on how Social Security administers, whether it's auto enrollment or not, because we're not Social Security. But what you're going to want to make sure is that you're providing that information once you are enrolled to SFHSS.
Thank you. And Mike, Laura, this will be the last one. Does Blue Shield cover mental health sessions? So we recently switched, right? There's no longer Magellan. Do you want to talk about the mental health
Correct.
benefit? Oh, you're on
So
mute.
sorry about that. I accidentally muted myself there. Certainly, we certainly just recently switched over to us managing our own contracts with the providers. You can find the list of providers out on our website, and we also have the ability to utilize our Teladoc Health to do the services over the phone if you don't want to go in person. So we definitely have providers for you. They'll just directly work with Blue Shield instead of having a middleman of Magellan. It's a direct connection between Blue Shield and the providers.
So that was the last question that we had time for. We do have another retiree webinar. Please go on to our calendar, sfhss.org/OE 2026. We have more webinars coming up this month where you can also sign up for a one-on-one consultation with our plan representatives. You guys all asked wonderful questions, and we so appreciate you for joining us today. And we hope you'll join us at another webinar in the future. Thank you so much. This concludes our webinar.